Thank you, Sir Desmond. It is a pleasure to serve under your chairmanship. We are witnessing an emerging public health crisis. The cosmetic and aesthetic treatment industry is expanding rapidly, yet our laws have utterly failed to keep pace. In 2023 alone, around 7.7 million people in the UK underwent treatments and procedures ranging from Botox injections to facelifts. Every single cosmetic and aesthetic treatment or procedure is currently under-regulated, both surgical and non-surgical alike. Each year, more people undergo these treatments, and each year more are left vulnerable to devastating complications because of a systematic failure in our legal system. The statistics paint an indisputable picture. Without raising the baseline minimum level of clinical standards, millions across the country will continue to suffer, and some will pay with their lives. We live in a time where beauty standards are set at impossible heights. Every single day, people of all ages are bombarded, whether through social media, advertising, magazines, or with messages telling them how they should look. And young women in particular are relentlessly targeted with new beauty trends, each one more unattainable than the last. Failure to follow leaves many feeling ugly and unworthy in their own skin. But let's be clear, they are not ugly, they are not unworthy, they are not imperfect, but more and more people are becoming victims. Victims of a culture that thrives on selling unattainable beauty standards. One day you're too fat, the next you're too skinny, your lips are too thin, then suddenly they're too thick. Your forehead is too wrinkly, your nose too pointed, the list goes on and on. There is always something to make someone feel that they are not enough. And the impact is undeniable. In 2020, a parliamentary report found that 61% of adults and 66% of children in the UK had negative body image. So what do people do? Many turn to cosmetic and aesthetic treatments, searching for confidence in a system that profits increasingly from their insecurity. But these so-called beauty standards don't just lightly shape how people perceive themselves. They create shame, pressure, and for some, a devastating impact on their mental health. A parliamentary report in 2022 revealed the scale of the problem. 80% of people said that negative views about their body had harmed their mental health. As confirmed by the Mental Health Foundation, the two disorders most closely linked to poor body image are eating disorders and body dysmorphic disorder, the number of diagnoses for which are on the rise. Currently, an estimated 1.25 million people in the UK are living with an eating disorder. Between 2015 and 2021, hospital admissions for eating disorders rose by 84%, and over half of those admitted were aged 25 or younger. Body dysmorphic disorder, despite stigma and underdiagnosis, is thought to affect over 1 million people in the UK, and the true figure is almost certainly far higher. And most shocking of all, 1 in 8 people experience suicidal thoughts and feelings because of body image concerns. This is a crisis. More and more people across the country are suffering, and many are developing life-threatening health conditions. But the truth is, something can be done. The Mental Health Foundation found that 21% of adults said that advertising images had caused them body image concerns, and 40% of teenagers said the same about social media. Yet right now, the cosmetic and aesthetic industry is free to advertise however it wants. Businesses can digitally alter images beyond recognition and present them as reality. And social media influencers are allowed to push cosmetic treatments straight at young people. Currently, the Advertising Standards Authority and the Committee of Advertising Practice restricts the use of enhancements that make an image misleading and restricts cosmetic advertising from being targeted at under 18s. But this evidently is not enough. We need tougher regulations. Tougher protections for young people on social media, tougher rules to stop the public from being misled. The answer? Requiring all images and videos used in advertising on every platform to display a clear symbol showing if they have been digitally altered or enhanced. Now, this idea was first put forward by my colleague, the member for Hinckley and Bosworth, in a private member's bill that sadly did not make it through all parliamentary stages before dissolution of the last Parliament. This requirement, alongside stricter enforcement of the advertising ban on under 18s, would protect young people from harmful online content, expose the false promises of cowboy practitioners, and help people finally see the reality behind the images. But of course, advertising regulations are not the only changes that this industry is in desperate need of. Right now, in the UK, anyone can perform non-surgical cosmetic and aesthetic treatments. And anyone on the General Medical Council register can carry out surgical, cosmetic and aesthetic procedures. We live in a regulated society, leading to the misconception of many that this industry is already regulated. After all, the rest of the medical sector is, so why would this not be? Many genuinely believe that the practitioners they visit have a medical background. They may see official-looking certificates on the wall, and they presume that the training being claimed to have completed is of the same rigorous standard that nurses and doctors go through. The reality, however, is I could sign up to an online course, complete roughly 10 hours of coursework, I could attend 2 days of in-person training and call myself qualified to perform fat dissolution or Botox. Or I could sign up to another course, watch a series of specialist videos, and then be qualified to inject lip fillers and dermal fillers. How on earth does watching a few videos or attending a 2-day course qualify anyone to perform treatments that carry serious risks, including blindness, tissue necrosis, paralysis, or even death? If I was having a simple blood test, I would expect a nurse trained in phlebotomy to handle the needle. If I needed my appendix removed, I would expect a general surgeon to perform the operation. If I was having needles put into my face or my nose operated on, I would expect the person holding that needle or scalpel to have the medical qualifications required by the NHS, meaning specialist training and CQC registration. Today's debate is about non-surgical treatments, but let us be clear, surgical procedures are also in desperate need of regulation. After meeting with the Royal College of Surgeons, it is evident that we must tighten the rules on who is allowed to perform cosmetic and aesthetic operations. And we must amend the Health and Social Care Act, expanding the powers of the Secretary of State to introduce regulations on operations and making surgeon a protected title. I would welcome the chance to meet with the Minister to discuss this further, because we cannot allow non-surgical treatments to be regulated while surgical procedures are left behind. This must be one overarching framework that encompasses all cosmetic and aesthetic treatments and procedures. And at the very heart of that new framework must be a minimum baseline standard of practitioner training. The absence of such a standard has allowed low-quality, unsafe, so-called clinics to spring up across the country. They decay our high streets, they feed the black market with untested medication purchases, and make access to dangerous treatments easier than any others in the medical sector. These cheap, unregulated clinics, run by anyone who fancies giving aesthetics a go, are putting people's health at serious risk. They buy cheap products that may never have been properly safety tested in order to undercut professionals with bargain prices. And it works. Young people in particular are increasingly drawn in. They do not offer consultations with alternatives or risk discussions. They do not offer cooling off periods. They do not adhere to safe environment standards to protect infection. In far too many cases, someone can walk in off the street and undergo treatment on the spot performed on a living room sofa. But what happens if something goes wrong during the treatment? What happens if something goes wrong after? And for many it does. In 2023, the government approved Register for Medical Aesthetic Treatments, Save Face, received over 3,000 reports of complications and adverse outcomes. In July 2025, an ITV investigation revealed that over 50% of women who'd undergone non-surgical cosmetic procedures required medical assistance afterwards, with 15% requiring emergency support. SafeFace confirmed these findings matched their patient records. And this demonstrates exactly what happens when unqualified practitioners are allowed to continue unchecked. People are suffering serious health complications. Many are left traumatized, and countless others never seek help at all, out of shame and out of stigma. And when help is required, it often falls to the NHS to provide corrective care. That is care that costs time and money. There is currently no exact data on these costs. However, an NHS Scotland study found that over 5 years, the average cost of correcting botched procedures and surgeries was £9,327. To put that into perspective, a study in the European Journal of Health Economics reported that the average cost of treating breast cancer is £9,450. So what do we want the government to do? This is not a party political issue. This is not just a health crisis, it's an economic one too, and it's entirely avoidable. That is why regulations adopting a traffic light system that categorises every treatment and procedure with a minimum baseline of standards is imperative. Green for non-prescription treatments. Amber for treatments involving prescribed medicines or that penetrate the skin. And red for surgical procedures requiring anaesthesia. And with it, clear rules. All treatments across the three categories must be performed by CQC-approved professionals with at least professional indemnity and public liability insurance in a sterile, fit-for-purpose clinical environment. Any treatment involving prescription-only medications such as Botox or certain HRT types for weight loss must be performed only by a prescriber or by a regulated professional with the prescriber on site at all times during the treatment. All treatments involving injectables must be performed only by a medical professional registered with the relevant professional body, such as the NMC or the GMC. Every consultation must include a discussion of all alternative options and potential side effects, followed by a mandatory cooling-off period before the procedure may go ahead. And during this time, individuals should feel under no obligation to commit, and any deposit paid should be fully refundable. Every surgical operation currently required to be performed by anyone on the GMC register must be performed by a specialist surgeon. The United Kingdom is home to one of the best healthcare systems in the world, yet in this area we are falling dangerously short. It is time to put that right. This is not about banning or shutting down businesses, but instead must be viewed as introducing protections for patients, practitioners, and for public health. The government's announcement in July pledging to regulate was a welcome step forward, but real concerns do remain about the timeframe. This cannot be a 2 or 3 year project. The industry is growing far too fast for that, and patients are suffering too frequently with the NHS and society already paying too high a price. We need urgency and we need clarity, along with a firm timeframe. So right now, because of failures in the law, this industry is instead risking lives. It preys on the vulnerable, and particularly the young. It burdens the NHS and leaves countless people traumatised for life. That is the choice before us. We can allow this crisis to continue unchecked, or we can act with urgency and courage needed to protect the public, because the truth is that every day of delay is another life put at risk, and we can't allow that to continue.